Today, I am pleased to report that 6,624 Albertans have recovered from COVID-19, leaving 328 active cases in the province. Currently, 44 people are hospitalized, with 6 of these in ICUs. In the last 24 hours, out of 6,455 new tests, there were just 7 new cases. I am happy to report no new deaths today. Today's numbers mark an occasion to be celebrated. Not only are we reporting the highest number of tests done in 24 hours in the province, we also have the lowest daily number of new cases since March 12th. The number of active cases in our province continues to trend downwards. This is in large part thanks to your efforts and sacrifices. One especially difficult sacrifice has been being unable to visit our loved ones receiving care in hospitals. Though this restriction was made to protect the safety of patients and our healthcare workers, I know this has created hardship. As the COVID-19 pandemic has evolved, we have continuously monitored the situation and adjusted our measures as necessary. Effective tomorrow, Alberta Health Services will be releasing updated visitation guidelines for all patients in both acute outpatient and inpatient settings. These revised guidelines expand the allowance of some visitation while maintaining specific criteria intended to protect patients, residents, volunteers, and staff. For more information, you can access the updated guidelines from AHS's webpage. I want to be clear that these guidelines only apply to hospital settings.
We know that it has been challenging for Albertans to have loved ones in hospital and to perhaps not be able to visit with them. Similarly, in outpatient ambulatory care clinics, it can be difficult if someone is accessing care and can't have a support person with them. So the guidelines, the updated guidelines, will be posted on the AHS website, ahs.ca/visitation. And so the updated guidelines will be posted there. But in essence, what will be permitted starting tomorrow is for ambulatory care visits. An individual coming for care to an outpatient clinic can be accompanied by one support individual. And for hospitalized inpatients, 2 designated support individuals can be identified so that they may visit at the same time. As long as there is space for both to visit at the same time, they can visit. There needs to be maintained physical distancing. They will be required to have a health assessment to ensure that they are healthy and able to visit the hospital, because we do need to protect our staff and other patients in the facility. And they will be asked to wear a mask and potentially other personal protective equipment, as well as to perform regular and frequent hand hygiene.
The existing standards and rules for continuing care remain in effect. We know that visitor restrictions in continuing care are a hardship in these settings as well, and we will be seeking input from residents, families, and operators on how we can balance needs for connection and needs for safety in these settings, so we can continue to make adjustments in the best interests of all those in these settings. As we prepare to move into Stage 2 of Alberta's relaunch and more activities in our society resume, we must continue our basic prevention measures to keep our numbers low. Although we can expect to see some fluctuations in new infections and outbreaks, it is possible for us to collectively keep our numbers stable. If everyone practices good hygiene, stays 2 meters apart when that is possible, and wears a mask when it is not, that will help reduce the spread. Our pandemic response will help to keep Albertans safe during relaunch.